A new report from Conservative Competitive Enterprise Institute, or CEI, peels back the curtain on just how much the nation's preeminent public health institutions have pivoted to controlling lifestyle choices over preventing infectious diseases such as COVID-19. Find out more on this edition of Ruthless Insider. Hello and welcome to another edition of Ruthless Insider. CEI senior fellow Michelle Minton found that a vast majority of congressional funding allotted to the Centers for Disease Control and Food and Drug Administration went towards reinforcing public behavior, while only a fraction of the agency budgets were targeted towards fighting emerging pathogens that have given rise to the public health pandemic today. Of the roughly $7 billion granted to the CDC in 2019, less than half of the funds went to infectious disease efforts, where most went to fight existing viruses. Where more than $600 million was spent on animal-related diseases, only a third of that money was spent on emerging threats. To put it simply, CDC resources for rising pathogens such as the novel coronavirus, which is supposed to stand as the CDC's current core mission, received far less funding and focus than hyping a moral panic around vaping. The FDA, meanwhile, is no less guilty. Its aggressive action, propelling hysteria surrounding Ecigs, remains to be far from the FDA's actual goals or public interest, and frankly, continues to damn smokers to a terrible fate. Electronic cigarette use is the single most effective form of smoking cessation, offering a lifeline to those trapped under addiction to combustible cigarettes, which is the leading cause of preventable death in the United States. By now, it's been well established that the government's initial response to the pandemic has been a disaster. While the FDA was conducting raids on e-cigarette manufacturers, the nation sat vulnerable to a pandemic. Testing capacity was woefully inadequate, and the federal agencies actively prevented states and universities from pursuing tests of their own. To make matters worse, initial tests by the CDC didn't work, and the public was misled on whether preventative measures like masks would work to slow the spread. Do you feel that the CDC and FDA could be better allocating their funding, or did the Uvalde scare of 2019 really warrant that much attention in contrast to the current pandemic situation? Please share your thoughts with us down below, and as always, don't forget to like, share, subscribe, and ring that bell button to keep up to date with all of our Ruthless content. This has been Nick with Ruthless Insider, and we will see you in the next video.